Good afternoon, everybody, and welcome to the Performance Health webinar, which we've called What a Nerve. And this afternoon, I'm going to just be exploring some splinting ideas for median, ulnar, and radial nerves. They're just ideas. There are many more available, of course. So my aims for this webinar. So we're just going to explore some of the splints that I will be making for my patients. We're going to look at the different properties of the materials and maybe why I've chosen one material over another, which gives you a little bit of guidance as to what you might like to have in your clinic, and the clinical reasoning around why you might choose one design over another. And then we're going to just have a look at one of the off-the-shelf splints as well as the custom-made splints. And hopefully at the end, there'll be enough time to have a bit of interaction with you. If you've got questions, we can use the chat, and my lovely assistant here with Sam at the end will nip round the back and feed me some of the questions, and we'll try and manage as many of those live as we can. But if you've got questions that I don't manage to get to, I will send emails to each of you individually. So the other exciting news is that after a lot of work, Performance Health have managed to work a system where we can recycle all our offcuts of thermoplastics, which have been long in the coming, and I am so excited. All you're going to need to do is contact your rep, and your rep will be able to come in with a box and a QR code. You'll just fill it up with your remnants. They will then take it away, and I think it's being used for developing energy, isn't it? So a very green way of recycling it and feeding back into the national grid, hopefully. So please just get hold of your rep, and that will be coming out over the whole of the UK over the next few weeks and months. So let's start with the median nerve. So as we know, every single person who has something wrong with their hand, they think they have carpal tunnel. And we can all have a little chuckle because we know that an awful lot of them don't. But an awful lot of them do. And the first thing that the NICE guidelines suggest is that you give somebody an off-the-shelf splint for 6 weeks. So here we have a very typical neoprene-based off-the-shelf splint. And the first thing that's really worth you just taking note of, because people are going to their pharmacies, they're going online and they're buying these, what they don't realize is that they are basically made with the angle of the bar inside somewhere in the region of here to here, which sits you in extension. And of course, if you are wearing this splint to help you with function, well, that's perfect. But if you're wearing this splint because you want it to hold the carpal tunnel in its most open position, which is around 0 degrees, the first thing you need to do is to bend the bar. So take the bar out, bend it, put it back in again. So we just need to make sure that information is getting through to our patients, and that they're wearing a splint that fits them well. So what are we looking for a splint that fits well on the hand? So if we pop the elbow down there, that's brilliant. And then that works really well for the camera, I think. So what we're looking for is some nice fit, and to make sure that the fingers are not occluded. So you want to make sure that this is low enough down here that she can really make a really good fist. And you can see the bar is now not holding her, so she is much more in that neutral position. And that it's contoured a little bit into the hand if you possibly can. And to make it easier, hopefully you've got a little bit of tab free. What I sometimes suggest to people they do is to stop this catching on things, is to fold it over and you can just sew these edges. And that works really nicely. It makes it easier to pick up the tab. Or if people have got issues with their hands and the pulling of that fine pinch or they're arthritic, if you cut the tab, like, sorry, I wouldn't normally do this on my patient, but hopefully the same actually. Okay, so if I make a little hole in here, which I'm doing in a very disorganized, rudimentary way, but essentially here. Now what I've got is a nice hole to lift up and pull in with, which actually makes life a little bit less difficult, or you can use on the D-rings. Of course, that again makes it much less effortful. So, okay, enough of off-the-shelf splints. And let's move to what we're going to do if we have somebody that needs to wear something during the day as well as night. Okay, let's get rid of it. So, day splinting for carpal tunnel, or of course any wrist extension splint, or something that's supporting around the wrist if you've had a synovectomy here, or all sorts of other reasons, we're going to need to make a splint that supports the hand. And sort of like a gutter along the forearm. Now, what's really important is if this is a day splint, we need to think about the function of that particular individual. So do you spend most of the time typing? Do you need to be able to drive? Are you actually doing writing? Is it a dominant hand, a non-dominant hand? And we need to remember that we can make these splints radial, dorsal, ulnar, or volar. So I thought I would just do 2 today. And I know people really like when I do pattern making. So if we just go to the overhead camera here. So if I was going to be doing this splint for a carpal tunnel, I'm going to get my nice paper and I'm going to make my splint like here. I'm going to mark my MCPs, IP of the thumb, MCP of the thumb, CMC, and the wrist. And I just do that automatically every time. Now, if I'm going to make a volar splint, again, I want the gutter to follow the line of the forearm here. And then I want to make sure that if this is the metacarpal heads here where I've marked, the distal palmar crease is significantly below that. So I want to make sure that I'm below the distal palmar crease to give me free movement of the fingers. And then I want a little tab to come through the web space. And I want to make sure that the femur arch is also free. Now, on my thumb, for example, if I were to mark my femur arch, it's over halfway across ulnarly. So if I really want to have good free thumb movement, which you are not going to get from an off-the-shelf splint with that whacking great piece of metal that sits up the front of the hand here. So if I want to do that, I've really only got this part of the hand to work on. So here's one that I pre-cut up already. So let's just show that onto the sun's hand. Now, let's see, it might be better on the front, I think. So if we are making sure we've got enough space here, so you can see to allow good thumb movement, I need to make sure that I really have arch around the thumb. I need to make sure that I'm going to come low enough here below the distal palmar crease for really good flexion. Okay, and then we want on the forearm, we want to make sure that we've got a nice gutter, and that gutter should be about 55 to 60% of the circumference, so that it doesn't roll, but it's also not too high up, so it's tricky to get on. So again, just to make life easier, I pre-cut one. And this is Easy Form 1.6. So I'm just going to pop that into the splint pan. I already cut it out, which means that the edges on the splint are cut it out at the right temperature, so it's sealed really nicely. So there shouldn't be any nasty little bumps on the side of the splint. And here we go. Oh, so if you want gravity to work with you, turn the hand this way up and say you're supinated. And I'm just going to roll here in the palm, which I find just gives a really comfy edge against the hand. Now, we always think of Easy Form as being really rigid, but actually, as you can see, it rolls beautifully. It's the right temperature. It will roll really nicely. And once it starts to, it's basically doing itself, isn't it? I'm not doing the whole heat here. I want to control where the wrist is in space. Now, this is where it becomes really important to know what your patient does on a day-to-day basis. So if it was a dominant hand, and you write a lot, what I would actually do is give you a pen to hold and then make sure that I'm supporting that metacarpal arch here. And in fact, I might even make this radial to leave the ulnar border free, which makes it even easier when you're putting your hand down and working here. But if you're going to write and you're in this sort of grip, you need to make sure that that metacarpal arch is really it's more extreme. And we'll look at the difference with a different type of splint for a different sort of activity in a minute. I've pre-cut all of these. Those OTs out there are going to love, I don't know if you can see, but I've basically made a little holder for my Velcros. So here, here. And then I would probably use a wider one, to be honest, it'd be a bit more comfortable, but I've opened this one out, so I'll do that for now. Here, here. What's really important is that we always make sure we explain to the patient, cover over that hook Velcro completely, otherwise it's really uncomfortable. Now you've got a choice. You could add another strap across here, or you could allow a tiny bit of movement. And of course, if you make this fully strap on the dorsal aspect, then she'll have more ability to move into this position. Okay, but you may well want to put another strap across the metacarpals here to hold it nice and firm. Now, obviously, at the moment, you can see Easy Form has got quite a lot of movement, but it's also in here. Once this goes really rigid, you won't have that ability anymore. So there's that splint. Okay, but I might prefer to do a dorsal one. So if somebody does something work-wise and they really need to have the hand resting down a little bit of rest, I think we should be teaching everybody to tighten their shoulders. People do rest, particularly when then you might want to leave the whole aspect of the hand free. So we could dorsal splint. So here is a pattern that I've made. So if we see dorsally here over the top, Chris. Yeah, perfect. So you can see that we've got that sort of circumference around here to 50%. And then along the line of the metacarpals, we've left ourselves some extra material on both sides. And I've put these little cuts in it, which enables it to open out, and it will now gently sit around. And I can see then whether it will actually fit on the whole surface. But all of this then is free. So let's make the dorsal version. Now this one I have made of tailor splint. So tailor splint is much more floppy than Easy Form. So it will run away with you a little bit, but it molds beautifully, and these edges are absolutely lovely. So to tailor splint, piece you buy should be a 3.2 because you've got a longer time with it. It's not going to run away with you quite so much. But I've got 2.4 here, but it does come 3.2, 2.4, and 1.6. Now, tailor splint only has the one color. So this is the one thing I would say is sad about it. It's making the assumption that we're all sort of this color, which of course we're not. But anyway, so be it. So I'm just going to very gently pop that over. Now, of course, I don't want to stretch anything. It's too warm. Okay. Okay, so this I am going to make some little dog ears at the side to give me support. And now I'm really opening out that metacarpal arch, because if she's typing, for example, and I put her in this really crowded position, it's really not going to be comfortable. So I want this to be a little bit more open. And because tailor splint just molds itself, I've done nothing with it. It's just done it for me. Super easy. And as I always say when we're talking about splinting, if your pattern fits, your splint is going to fit. So there's so little you actually have to do to make it fit because it just fits. So it's super simple. And this one, you really do only need the 2 straps, 1 distal, 1 more proximal. I've made these out of black so that they're easier to show on the camera. And then again, we've got our Velcro. I did make my colleague laugh when she came in and she discovered that I'd made all of these boxes for holding the Velcro. It's like such an OT thing to do. Okay. So again, it is really warm. It's really warm in here, so it's going to take a while to just solidify. But again, if it's carpal tunnel, you don't want to go into extreme extension. You really want to hold it so that wrist is between 0 and 15 degrees of extension. Now, I have a feeling if I pop this off now, it's still going to flop because it's so hot in here. So now, the best thing to do is know, I'm going to tilt the splint, you don't tilt, okay? And then it comes off super easy. Yeah. Otherwise, you're dragging it along the hand. So that fits really nicely on there, and it's nice and rigid on the sides. Okay, so there's our second splint. So that is really what's going on with the median nerve. On the nerve. Let's think about the ulnar nerve. Now, I actually had a patient with an ulnar nerve palsy this morning, and with his permission, I took a few photos of him and I've just sneaked those into the presentation. So he is a professional flautist, and he developed an ulnar nerve palsy. Sensory is fine, it's just motor. He first came to me with quite an extreme claw. It is improving, but he's been wearing an anti-claw splint and he wears it to work. To work him. So you can see the splint that he's wearing. Interestingly, we've discovered that it's really his ring finger that is still clawing to an extent that he's got a problem, and he still can't separate his middle to ring fingers enough because the interossei are not coming in quite as well as they need to. So with him, I just make an anti-claw splint. Now it started with both little and ring. Now I only make it on the ring finger and with a slightly ulnar bias, because that helps him to get the fingers down onto the flute where it needs to go. So I'll show you how to make that, but for the 2 fingers, which is normal. Again, I've got easy form here. If you are new to it, again, I would go with a slightly thicker material because it gives you longer, but I've got the 1.6 here. So I'm going to pop that in. But I'm also, you can see, you saw on the side of the presentation, there was a more rounded one. So you could use an aquaplast tube. So this really fits nicely, works nicely onto the skin as well. So I'm going to show you making one out of a tube as well as one making it out of the traditional thermoplastic. So I'm going to pop that in as well. With the slight challenge that it goes see-through when it's ready, which of course means that when I go back to fishing out, who knows if I'll find it. Okay, so you can just imagine that the 7 fingers are sitting like this, and what I'm needing to do is to block them. So I'm literally going to start on the dorsum of the hand. Maybe we'll go here. I'm going to come in between the fingers, over the top, back under, through the web space, and back onto itself. Now, 2 things I'm going to do. One, in the web space here, I'm going to just roll it because that's much more comfortable. And second, in the web space here, I'm going to roll it because this really catches in that 3rd web space. You just relax the hand. Now, what I found with my musicians is rather than this technique, I need to make one little adjustment, and that is I need to do an opening on the top here, and then have some elasticated Velcro across the top to allow the hand to slightly open out. So if you're reaching on a piano, you're reaching on a wind instrument, you need to be able to get that extreme abduction, but you also need to have the hand open right out, and that's easily done by cutting through here, taking a couple of centimeters out and filling the gap with some extendable Velcro. So now, if you imagine that the Wissem has got the imbalance, now as she goes into extension, we're blocking here. And the nice thing about the Easy Form Light, so the 1.6, is it does always retain a little bit of bounce with it. So it goes with you. So if we turn you around this way now, if you open out now, you can see it gets a beautiful extension, helping the lumbricals working here and control of the MCPs. With the rounded here and in here, just for comfort. I would normally just run a heat gun just very briefly over this seam here and the one on the underside there, because that will also just future-proof it and make sure that when they're giving really hard work on it, it doesn't pop apart. Super easy to come off. So there's that splint. And then let's do the same splint, but let's do it in a tube here. This it looks like a nice bit of looks like a noodle. Okay, so we're going to run that over. Same again, cross here, because it's because it's circular and because it's got a hole in the middle of it. It actually has remarkable strengths to it. So I'm going to just squeeze those edges in there. Now, I don't need to do anything in terms of alterations in here or here, because it's so much narrower in the first place. And that is just going to sit. I often just would squeeze it on the side here because we don't want it bulking as she ab and abducts in the fingers there. And should have had a cold spray. We're going to leave you to blow on that for a minute with Sam. Brilliant. Okay. So while Wissem is blowing on that, and we are getting that splint so that it's nice and firm so you can see it, let's have a look at the other place that the ulnar nerve has a bit of an issue, and it's the elbow. Now you can see here on the next slide, that's it. There are all sorts of ways. You can teach people to just wrap a towel around their elbow. You can get one of the off-the-shelf ones that, again, people go online and they get them. If you do that, I like the ones that you control the angle, again, because we do have some science around the angle. We know it needs to be somewhere between 30 to 45 degrees for the cubital tunnel to be at its most open. So that's what we're really wanting to make sure. However, if those don't work, you can always go with a thermoplastic version. So again, I've cut out a pattern that really worked on the Sam's arm. So here we have this one I made earlier, and I have already cut it out. So this is a gorgeous color. This is Aquaplast watercolors, and it's their metallic blue color, which I find patients really like. So again, I've cut it out already. Now, I've cut this one out already, but Aquaplast is a memory material. So although I cut it out and cut it at the right temperatures and it sealed the edges, of course, because I'm now putting it back into the splint pan, the edges are going to open. So just always remember, a memory material, it's always, if you reheat it, those edges are going to pop open. So for something like an elbow splint, where you're very unlikely to get the rougher edge on the skin is very unlikely to be a problem. But on some of the smaller splints, I would only use a memory material if it's small enough that you can cut and mold in one go to keep the really nice edges. Okay, I think this is ready to, oh, how are we doing here? It's getting there, isn't it? It's getting there. Right, we'll leave it on. It's okay. So let's just get this one out. All right, so what do I want to do? I want to make sure that she's at the right angle. So again, remember we said 30 to 45 degrees. So 45 degrees would be, so let's go 90, half of 90, and take a little bit more off. And Aquaplast molds really nicely. So you can see that even though I've got an angle, and even if I came into more of an angle there, that's a little bit too much. But if I did, you can still see it have molded beautifully without ruffling on the edges. So that's one of the reasons I really like this material. But it's really, really, really smooth. And again, I'm basically doing nothing. I don't actually know what I'm showing you. I'm showing you me doing nothing. It's all in the preparation. All in the preparation. Right, so let's strap this. So what would I do? I would do a nice strap at the proximal end. I'll do a nice strap at the distal end. And then I might also, depending on how stable she feels, I may also do one just dorsal, just proximal to the elbow to help hold that on a bit better. Because the one thing you don't want is this to slide up and down. And if you've got a little bit less of an angle, then it might be tempted to slide. So there's again little tricks to help you with this. My trusty contour foam. Again, I would probably use the thicker Velcro, but I don't want to waste it. So we're going to go with the thinner one, but I would use a thicker one. So we've got one here. One here. Now, what I would do on this one is probably just attach a little bit of contour foam onto the back of the Velcro. I'll lift you up a little bit. Place that over the back. And now that feels secure, doesn't it? It's so different. Yeah, just tiny little bit. You don't need to put it on all three of them, but just that tiny bit there will help to hold everything in place so much better. And it's much more comfy. And one distal one. And there we have comfortable. Yeah. So just make sure that you look at the position that somebody sleeps in and ask them, do you lie on your back, do you lie on your front, what angle is your arm at? And if in doubt, I would generally go mid prosupination so that, it will accommodate a bit of pronation, a bit more supination without the crossover of the radius and ulnar really changing the angles on the forearm too much and making it uncomfortable. So let's pop that one off. Meanwhile, so there we go. It's a nice looking spring. Okay. Meanwhile, we now have our anti-claw splint that has gone off. So it's now rigid, isn't it? So now, as you straighten up, again, you can see if we turn you that way up. So you can see again, it's doing exactly the same, but you've got full flexion, so you can make a fist fully. And there's just much less material, and it's so quick and easy. These come in 3 sizes, by the way, and this is the middle size. The thin one is too thin, the thick one I think is too thick for this particular purpose. But there we have a nice rounded splint. Copy? Very right. So we've got our 2 on the nerve splints there. And we've left the most complicated till last, of course, which is the radial nerve, okay, which we're going to do on the other hand. And I'm going to show you 2 different patterns. I've done one out of etafor and one out of tailor splint. So I'm going to start with the tailor splint one. Now, again, what I quite often do is I give somebody something. So when you're doing a radial nerve split, what you really want is somebody in a very functional position. Pull that up just a little bit more. So I would normally give them something nice to, here you go, be nice. Lay your hand over like that. So we want to lay our hand so that we've got a really nice angle of extension on the wrist, but the thumb is sitting again in a functional abducted position. So you can see I've just popped with Sam's thumb. You can now see it. I know it's a bit awkward for you, but we'll just show you there. So that's sitting on the side there. And we want to make sure that we've got the third metacarpal absolutely in line with the forearm. And this is all sitting beautifully well there. Okay. You can use a rolled up bandage or a can or all sorts of things, anything you've got that's that shape. Too hot? So, what did I do for my pattern? I marked, obviously, my wrist, my MCPs, and then one of the things maybe I'll show you is actually how I worked out the thumb. Because when we take our patterns, our thumbs are in extension, of course, because they're flat on the table. When you're making the splint, of course, your thumb is going to be in abduction. So that is a whole different ballgame. And you need to leave extra space. Although it's something like tailor splint, you will find that it will mold with you, which is really helpful. So with this tailor splint, we're going to do something a little bit unusual. Here is the strap for the proximal end. Here is the strap for the wrist. This piece is sitting over the dorsum. If I just turn you back for a second, you can see that that's sitting over the back of the thumb here. I'll put you back there. Then I'm going to use some short pieces of hook Velcro along the back here. Now you're thinking, what on earth is she doing? Okay, those are sitting over the back there. It's just going off at the moment, so let's just strap it up. Slide underneath. That one, stability. Proximal. Now, there's obviously, because this is a more of a dynamic splint, there's more tension, there's more friction going through the splint. So I've made it just a little bit longer because the more surface area it touches, the more you spread the pressures. And now what I'm going to do is I'm going to show you, I just previously cut this. So it's a piece of neoprene, and I lay the hand down and I marked where the MCPs were. So I've got that arch that matches the angles of the MCP joints. And I'm going to just pop 1, 2, 3, and 4. This is the truest low profile dynamic splint you have ever seen, I suspect, or done. I think so, lots of it, right. I'm not that clever. I'm just putting a little bit of tension on it. And now you can see where she can have a radial nerve palsy. She can make a full fist. And then there's a dynamic pull up into extension. Okay, so that works really nicely. Now, it doesn't work so well like this for the thumb because the amplitude of the thumb is much, much more. So I would probably go more traditional with the thumb, but you could try this. So here is an extra piece of neoprene. Sorry, the purple and the blue make it a bit difficult to see. But here is an extra bit of neoprene. So remember, she's going to be sitting forward like this because she's got no extensors. So what am I going to do? I am going to put 2 little pieces. One here. And I'm just going to attach this. Now, usually EPL can manage with the thumb tip in a bit like this, but you might want to come on further. It just depends on your patient. Because if you cover this surface, they're going to have more of a problem. And now she can flex against it because it's bouncy and it will return to that position. So if I asked you to pick this up, you're pulling against it and now just relax and it's springing you back. Yeah? So again, and then it just springs you back. So this is a very, very low profile splint for somebody to wear for radial nerve. However, I fully acknowledge that what it doesn't do is respect the fact that you should have your pull at a 90-degree angle above in order to make sure that you are really being careful about the biomechanics. So it might just be that this is a useful splint design for someone in a particular occupation where they have to do some things where they slide the hand in and it mustn't get in the way. So if that's the case, this is actually a really nice design, but maybe not to be worn longer term. I'm going to take the rings off. There we go. So there's that splint. However, I have a second one that I'm going to do where we're going to, so that was tailor splint, which molds really usually. Now this one is easy form, so it's going to be a little bit more rigid, but I know easy form to easy form makes the most fantastic bond. So it's the perfect splint when you're adding one splinting material, when you're adding one material, one piece of material, or another piece of material. So again, this one. So we're having our bottle back. Okay, so these are identical. These two splints. Now you can see now this doesn't want to mold in the same way. But if I just do a little bit of a stretch on the side, now it does. So it's all you have to do with easy form is just give it a tiny little stretch and now it will mold like you want it to mold. There. And it sits now on that abducted thumb. The patient doesn't have to do anything. Step one. The second one. Now, we're going to need to have a strap also up the distal palmar crease, but we mustn't put that on yet because we're going to attach the outrigger. And if we attach the outrigger, if we attach the splints, the straps on now, then they're going to get in the way. So that comes afterwards. But what we will do is just get these right. One. So I hope you're putting some questions into the chat while we do this. That's the second one. Okay. Now what I want to do is mark on here where I want to put the outriggers. So what I'm probably going to do is I'm just going to do a scratch with my scissors. So I want one here, and then I know I want one over the back of the thumb. I don't want to do this while it's on you because I need to do the heat gun. Okay, so dry heat to dry heat is what we're looking for. So slight heat there, slight heat there. Then I have pre-prepared this. I partly pre-prepared it because there is another webinar that we did where we did dynamic splinting. So sort of thought you can always look at how I've done it here. Well, yeah, move out of the way of the heat gun. Dry heat to dry heat. On that goes there. Get a really nice bond. On this goes here. Again, just really work them into each other, and as long as you've got no water in between, that will be a permanent bond. Back into your functional position. Let's move it off a bit. Here we go. Get that splint on. Okay, so now what I'm going to do is fix this. And now I want to bring this bar directly over the middle of the proximal phalanges. So I know that the middle finger is the one that's going to be the longest. The little finger is going to be the shortest. So this isn't going to just be a straight bar. It has to follow that nice arch that we have naturally in the hand. And it's going to sit above the hand. Now, while that sits there, we've also got a thumb piece. I would normally take it off and heat both parts, but I'm just going to heat one part. And I'm going to attach this over the back of the thumb. Down here, and we do that, and then people can see. So the thumb's here, and now I'm just going to wiggle this. It's like a snake until I feel like I'm in the right place above the angle, just above the IP joint. And again, I might just go above the joint so that when I put the cuff on, I'm not actually covering the sensate area of the hand. Now, how's that? I'm not losing that. Obviously, we're doing this super quickly, so you'll have to forgive me if this isn't in quite the right position, but I suspect it won't be far off. Give me an extra hand. Okay, and then what are we going to do? So we've got these lovely cuffs that are suede. You can, of course, just cut out a Velcro, but these fit on and they're so comfortable for patients, so comfortable. And so you just wiggle them onto the finger. Now, obviously, they come like this, but they also come, all my dynamic splinting things, my mud's straps. So they also come singly. Let that go. You know, slightly long one. These are small. And you can literally just pull up like so. This is just drop down. I didn't even think about the temperature in the room. Now you can see the difference with this splint to get a really nice fit. Obviously, we are so much broader, it's bigger, it's going to be much more tricky for daily activities. So I've got my monofilament, which is basically just fishing line, which you're going to put through your cuff. Put that onto your thumb and put that through the hole that you have made. Now I had pre-done these, okay, before we came online. In case you wondered how come there was a hole in there, I had actually pre-done that. So I want to make sure that as we move into flexion, the angle of this is right. So I might just need to fiddle around with it a little bit. Do I want it here? Do I want it here? I'm just going to keep fiddling. And then I'm going to make a little channel for it to go along here. So how am I going to make the channel? Well, guess what? This is brilliant for that as well. So I'm just going to cut myself a bit of the aqua tube, and I'm going to keep that. Oh, I closed the lid. I'm about to chuck it in. I closed the lid. Okay, so that's going to go there. Leave the thumb for a minute. Now let's go here. Oh, this is now getting some solidity, so that works. Okay, so here's one for this finger. We want this to go through onto the proximal phalanx. Oh, they're really tight on you. They're not going to work very well on you. I would have to make some, to be honest. We didn't try this before, did we? And then this is going to come up and through. Right, where is that going to go to? So again, if I put a little bit of aqua tube literally stuck onto there, then I can feed it through. So all I'm going to do is I'm going to put a tiny little mark where that is for one. Let's do the same. Now I'd also pre-cut or pre-done all of these holes so that they would sit and I can choose the right hole. There. Should get easier from now. Fingers should get narrower. Go. Easy. Yeah. And if you want to see other ways of how you can fix these, then on the webinar that we did before, we looked at a whole variety of different ways to be able to fix your dynamic outriggers. Here's this one again, 90 degrees above, and I want to bring that there so it's really out of the way. Okay. Here are our four. I'll leave those on you, if that's all right. I'll leave that one on you. I'm just going to take this. Right. Okay. So I have thrown in a tiny bit of this for the fun. And I would normally do this sitting next to the splint pan, but I'll try and do it over here so you can see. Now, the one thing to be careful when you are doing, apple glass is quite sticky, so that's fine. But you just need to make sure that when you stick it down, don't push, don't press anything. So all you're doing is running that along, the tube along, okay? Because if you press it down, you're going to lose the hole through the middle, okay? So we're going to do the same with these. So we're going to cut little pieces. 1, 2, 3, 4. I might just do one of these so that we can go to questions. So I'm just going to heat in one space. Out my tiny little bit. And stick that on. Meanwhile, what I want is some nice elastic, which I brought out here. So you're going to get much more traction, much more length if your elastics are a little bit longer. So you could just attach the elastics off the top here. We did that in the last one, but I just thought I would show a different way of doing this. I actually need these to go off a little bit before I can make these work. Loop Velcro. So into the loop Velcro, I'll need to punch a hole. Okay, so while I'm doing this, let me just show that last slide to everybody. So I just, obviously it's this week, and Performance Health are offering a special deal on all Rollion products until the 20th of December. So all of these materials, so Aquaplast, Tailor Splint, Easy Form, they are all Rollion, everything. So literally any of these products that you want to use, if you buy them before the 20th of December, they have a nice big discount on them. And there's a code there for you, so you can see the code. Yeah, performance 20. Beautiful. So let me just show you this. So the splint is going to pop back onto the hand here, comes through. Now I think I'll do this one because this one I think is going off quicker because it's smaller. So I'm going to bring this through. I'm going to pop this through. Tube hasn't gone off yet, which makes it a little bit tricky. Once it's gone off, it becomes super easy. There it is. Has appeared. So just relax your hand. There we go. So that's there. I don't want to pull too tight because it's going to pull on it. And I'm going to attach some elastic. Right up at this end. So look at the most extension and the most flexion somebody can get. Moving all this rubbish out of the way, you can see a bit better. So I'm going to look at the amount of flexion she's got. That's as far as she can go there. Okay, so I can knot it at that point and know she'll get good flexion. Okay, just relax the hand. So I'm going to attach some very nice elastic through that hole there. I would probably tie it a good few times. Then I'm going to tie this into the bit of loop Velcro, super easy. And then here's my nice elastic down onto there. And now you can flex and it will dynamically extend you. Yeah? Okay. Cool. Okay. Let's pop that off. Let me release you so you can go and have a look. Take these off. Okay. Go. I'll let you take it. You run around and have a look and see what we've got in terms of questions. And I'll just get the splints out that we've made so that we can talk about them. Here we go.
Right. One of the first questions we have is, how do you know what size to use? I was always told adults need 3.2 millimeter. However, I agree with using 2 millimeter or 2.4 on women and 3.2 millimeter on men as they have larger hands.
Okay. So I don't agree with that at all. And I was taught exactly the same thing as you. You needed 3.2 because you needed the rigidity from the material. That is not the case. I have made huge big splints on really quite big men out of 1.6 material. The trick is you've got to get a lot of contour into your splint. So the more contour you build in both planes, the more rigid it is. So you can actually at least go down one size, but probably right down to 1.6 for almost all of the splints that you do.
Okay. Next question is, what is Aquaplast thickness you are using for the elbow cubital tunnel, please?
Yeah, so the thickness of this is actually 2 mil. So it's 2 millimeters. And this is actually a case in point. You would think, you know, whole arm, it's a big splint, you need to use a heavy, big material. Actually, this is really quite rigid now. Really not, it's not going to give at all. It's only 2 millimeters. So you can cut down your cost and you can cut down your plastic usage by going to a much, much thinner material, but getting more contour into it. So this is 2 mil.
Do you find that patients are compliant with use of an outrigger, or do you more prefer a low profile option despite being a poor angle of fall?
So the question was, do I prefer to use an outrigger with a full outrigger, or do I prefer something more low profile? And how compliant are patients? That's a really difficult question to answer. And the reason I go is because it depends on the patient. It depends what their functional demands are. It depends how desperate they are to function. If they need to wear a splint all day, every day, I think this isn't a good idea, particularly if it's going to be in the longer term, because it doesn't respect the biomechanics. But there may well be activities that they do which make a full outrigger completely impossible. On the other hand, some people function quite well just in a wrist brace for radial nerve palsy. So just by using their intrinsics, they can actually get some function. So I really would assess the individual patient and their functional needs completely separately. And I'm a great believer in adherence. I don't like the word compliance, but adherence to what we ask someone to do basically is an insight into how well we've brought them with us in our clinical reasoning and how well we've understood how they need to do things in their world. Basically, patients become non-compliant or non-adherent to our treatments. Often, well, if the splints don't fit and they're really uncomfortable, but also if their functional needs or their nighttime needs or are just not being met by the splints they're being given.
Do you use EasyForm 1.6 for pediatric ulnar claw splints?
I use it for all ulnar claw splints. So I would use 1.6. I sometimes go up to the 3.2, but 3.2 gives you, even in an adult, it gives you a huge amount of rigidity. You lose the bounce. If you want that bounce to stay with it, then you're better off using something like Aquaplast or Polyflex for that same splint, because it retains that ability to have some bounce. If you use EasyForm 3.2, it is absolutely rigid. You see, this allows that dynamic motion of the fingers, which it's still giving you that block, but it still allows movement, which is really important. So I would go thin for all of them unless there's a really good reason not to.
Next question is, can you use the load profile for long-term radial nerve splint for nerves that are not going to recover?
That's a really good question. I don't know. So the question is, can you use this really low profile splint for the longer term? You know what I would do is actually, rather than on the hand I was working, which of course was a lot bigger than my hand, but because I have silly, very small sized hands. But what I would do, can you see that this splint only comes up to the MCPs? If I was going to use this on a longer term, I would actually bring this distal edge up to just maybe 1/3 up the length of the fingers, with the fingers in extension. So the lip is sitting here. And then once this is on, then of course we are getting better biomechanics. It's just a bit more bulky, and you definitely have to have really contoured material because there'll be a lot of friction on this part of the hand. But a really well-fitting one for longer term use, I would use something like Taylor Splint or Polyflex 2, and I would bring it further up. And then yes, I think you can do that.
Just conscious of time, we've got time for one more question, and then we'll answer the other questions.
One more question, okay.
Do you find that patients pull out of the anti-claw splint if strong, and do you need to have reinforced edges or not?
Do they pull out of the anti-claw splint if you've got a really strong patient? I have had one recently who actually did. And we had to look at an alternative solution because it was a long-term situation. But most of the time, no. I think the key is use the right thickness material with the right amount of rigidity. Make sure that you seal your edges here and here to make sure you get a really good bond. And I mean, you could do a little bit of an extra bar across on the ulnar border. But I do, and that would give you a lot more stability. I haven't found it was necessary. But yeah, that's the great thing about splinting, is it's all about imagination. So we've reached 2 o'clock. I'm sure you've all got patients waiting. Mine will be here soon. It's lovely to see you all again. Have a great Christmas and New Year, and hopefully I'll see you again sometime in 2026. And don't forget to call your rep to get your boxes to get your recycling done.